So alcohols are nothing but they are the fermentation product of your sugars. Sugars when fermented, you will get alcohol as a fermentation product. So naturally it is done by one enzyme known as zymase. So zymase will convert sugar into alcohols. Now what are the different alcoholic beverages that are available in the market? So alcoholic beverages may be available as a malted liquors. So now what happens in the malted liquors, the material like your barley or sprouts and all that, those are soaked in the water and zymase, and they are all ready to ferment. And the fermentation product is nothing but these are known as malted liquor. Okay, so they are not distilled. So whatever alcohol is generated or that is being generated in this liquids, it is not fermented. So unfermented alcohol along with the raw material, they are obtained by fermentation of germinating seeds, cereals, then they are undistilled. Okay, so इसमें से pure form का alcohol separate नहीं किया. So normally alcohol content of these malted liquors that ranges from 3 to 6%. For example, beer. Your beer has around normally it was previously your beer was having percentage of alcohol in a range of 3 to 6%. But nowadays beers also available with the 10% alcohol. Okay, so these are known as malted liquors. They are not the alcohol whatever is the fermented in that raw material is not distilled. Okay, so it is undistilled. Okay, along with your raw material, alcohol is there in along with your raw material or original liquor. So that is known as a malted that is known as a malted liquors. Now second is wines. So alcohol used by again alcohol is produced by fermentation of natural sugars present in the grapes, fruits, other fruits, etc. etc. Again this alcohol is undistilled from the original raw material. Okay, so यहाँ पे grapes का जूस बनाते हैं, grapes का जूस, और उसको ही ferment करते हैं. So उसमें जो sugar होता है natural sugar grapes में, या फिर कोई दूसरा फ्रूट से जैसे एप्पल से भी प्रोड्यूस करते हैं. So whatever wines they are produced from the fruits, grape and other fruits like your apple fruit. Again, whatever alcohol generated is not a distilled alcohol. Okay, it is a undistilled alcohol. In case of wines, you will have around 12 to 16% of alcohol. 12 to 16% of alcohol. For example, red wines. So you might have seen in many movies they are drinking red wines, and most of the actors they used to make an advertisement of this red wines. It is healthy for skin and all that. Because of that, your fruits will have some kind of antioxidants. So particularly grape wine, उसमें antioxidants होता है, and that's why they are important. Then champagne is also there. Champagne will also have same percentage of alcohol, 12 to 16%. But what happens in the champagne? So champagnes they are manufactured or they are packed before fermentation is complete. So fermentation के लिए आपने डाला है before fermentation takes place. Completion of before fermentation. So whatever liquor is there, that is packed into the bottle, so that the carbon dioxide whatever will be evolved from the fermentation process, that will produce a foam inside the bottle, and that is nothing but the champagne. So champagne is also a fermentation product of your fruits, your grapes wine and all that. Now again another term is there, spirit. So what do you mean by spirit? Alcohol is distilled after fermentation of alcohol is again here in case of spirits, alcohol is generated by fermentation only. But in this case the alcohol is distilled off. Okay, so pure alcohol is obtained. So alcohol is distilled after fermentation. For example, in case of your rum, whiskey, brandy, vodka, so normally alcohol content may range from 40 to 55%. But whatever the beverages you are getting in the market, so whatever the brands, that may be either Royal Stag or Imperial Brew or any other. So I will not list all the brands, otherwise you will doubt me. So that is nothing but the spirits. So the basic difference is nothing but the spirits are distilled, okay, from when there is a completion of your fermentation, and wines are not, the alcohol from wine are not distilled off. Alcohol from malted liquor also are not distilled off. That is the basic difference. I will not add any sort. Now spirits are nothing but the alcohol which is distilled after fermentation of the mother liquor. For example, rum, whiskey, brandy and vodka, all that. So normally 40 to 55% alcohol is present over there. Whatever the brands available for drinking. Okay. So in the India, all brands listed up should have 42%, 42.8% volume by volume or 37% weight by weight percentage of ethyl alcohol. Most of the time alcohol means ethyl alcohol, because most of the time this ethyl alcohol is present in the different kind of beverages, and we are going to discuss this pharmacology and all that, intoxication and all that. Now absolute alcohol, what do you mean by absolute alcohol? So absolute alcohol is nothing but the 99% of alcohol weight by weight. It is in a dehydrated form. So water is always present as a solvent or impurity in the alcohol. Okay. So whatever alcohol is there in your lab, so it is not a absolute alcohol. So it is a it may be around 85 or 90% alcohol. 10% water is always there with alcohol. Now if that 10% water is also removed, then it is known as the absolute alcohol. So 99% weight by weight alcohol is nothing but the absolute alcohol. Remember this. Then rectified spirit. What do you mean by rectified spirit? So rectified spirit means 90% of weight by weight ethanol and 5% of weight by weight ethanol. So that is meant by rectified spirit. So rectified spirit क्या होता है? Ethanol plus methanol. So rectified spirit is nothing. It is not suitable for consumption. ये एक याद रखो. Now proof spirit. इसके ऊपर GPAT में क्वेश्चन आ चुका है. What do you mean by proof? Alcohol, mainly ethanol, 57.1% weight volume by volume or 49.29% weight by weight ethanol. Okay. So again 57.1% weight volume by volume or 49.29% weight by weight ethanol. That is known as a proof spirit. Proof spirit. But what is the term proof spirit itself? So this proof spirit was used to evaluate the quality of your alcohol in the olden days. इस पहले पहले जमाने में क्या था कि क्वालिटी उसका चेक करने के लिए प्रूफ स्पिरिट नाम का टर्म यूज किया था. वो क्या करते थे कि विस्की लेंगे आपका और गन पाउडर लेंगे और उसको मिक्स करके इग्नाइट करेंगे, तो वो क्या होता था, एक्सप्लोड होता था. इफ whiskey is pure, that means if whiskey consists of only alcohol, so that if whiskey is pure then it will ignite. If whiskey is mixed with your water, then when it will be sprinkled or it will be sprayed on gunpowder, it will not explode. So that is a proof spirit. But for your exam you just remember what I mean by proof spirit. So it should consist of 57.1% volume by volume ethanol or 49.29% weight by weight of ethanol. That is a proof spirit. Denatured alcohol, methylated spirit or denatured spirit. So it will have 95% of rectified spirit plus 5% of methanol, which is unsuitable or unfit for drinking. You might have seen in a news or newspaper, देशी मतलब गावठी दारू पीने से बहुत 10 जनों की मौत, 5 जनों को पॉइजनिंग, ऐसा कुछ देखा होगा. So that is because of while doing the fermentation, while doing the household fermentation of alcohol, जो आपका molasses होता है वहाँ से बनता है. Maximum alcohol is produced by from the molasses, fermentation of molasses. What is molasses? It is nothing but the waste product of sugar industry. Sugar industry में जो molasses बनता है, that is the waste product. Okay, and from that only they are making alcohol by fermentation technique in the distilleries. So remember this. Remember the proof spirit. So it is nothing but the 57.1 volume by volume ethanol. Then methylated spirit or denatured spirit means 95% rectified spirit plus 5% methanol, which is unsuitable for. Now we'll see pharmacological actions of ethanol on your body. What are the different pharmacological actions of ethanol? Pharmacological actions of ethanol on your body. This alcohol has a both local as well as systemic action. Systemic as well as local action. So what is local action? So it will act as a rubefacient, counter-irritant and antiseptic disinfectant when applied it locally. Ethanol. Okay. So that's why you are using a hand wash and all that for disinfection. Now this is a local action, rubefacient and counter-irritant, antiseptic, disinfectant. Okay. So then what is the systemic action? Now first we will see what is the action of your ethanol on central nervous system. CNS के ऊपर क्या action होगा? So obviously it has a depressant effect on your CNS. It has a initially your alcohol or ethanol will cause stimulation or simulation, hallucination, okay, excitement. Afterwards it will cause depression. So initial stimulation and then persistent depression. So it will promote the action of GABA in a higher concentration. So GABA is nothing but the inhibitory inhibitory neurotransmitter in the brain. So that's why the depression produced by ethanol, okay, in humans, that is because of the GABA mediated action. It will promote the action of GABA. Also inhibit the NMDA receptor, excitatory receptor, N-methyl D aspartate receptor, augment the level of serotonin. Then now what is the action of ethanol on cardiovascular system? सीएनएस पे तो क्या करता है, इनिशियली स्टिमुलेट करता है, बाद में डिप्रेस करता है सीएनएस because of the action on GABA, then inhibition of NMDA receptor and augmentation of your 5-HT. Now what is the action of ethanol on cardiovascular system? So first cutaneous vasodilation. So आपका जो limbs होता है, hands and legs, उसका जो blood vessel है उसको dilate करेगा. So you will feel a warming sensation होगा, आपको थोड़ा सा गर्मी महसूस. तो इसलिए वही ना पंजाब के लोग जो होते हैं वो क्या करते हैं, ड्रिंक करते हैं ठंडी में. क्यों? Because of the cutaneous vasodilation caused by ethanol, so you will feel little bit warmer. Again, in moderate dose, it will cause tachycardia. Tachycardia means increasing the heart rate. So in moderate dose, alcohol will cause tachycardia. It increases the blood pressure due to muscular activity, and in a larger dose, it will cause directly myocardial. It will cause in a larger dose, it will directly suppress myocardium, vasomotor center depression. So in the larger doses, it will depress your heart due to suppression of your vasomotor center. Okay, next one is a pharmacological action of this alcohol or ethanol. See, ethanol is being discussed as a prototype of alcohol. Okay, so initially it will cause this on cardiovascular system. Ethanol will cause cutaneous vasodilation and feeling of warmth. Then initially it will increase the blood pressure due to increase the muscular activity and sympathetic tone. Sympathetic stimulation करेगा initially और उसकी वजह से blood pressure वगैरह increase होगा. But in a larger doses, it causes depression of myocardium, vasomotor central. So decrease in the blood pressure and cardiac output. So in a moderate dose, it will increase the cardiac output blood pressure due to sympathetic stimulation. In a larger dose, it will directly decrease the myocardium. Okay. Now we'll see the pharmacological actions of ethanol on GIT, gastrointestinal tract. In a low dose or low concentration, it will promote acid secretion in the stomach. क्या करेगा ये? स्मॉल डोसेज में एसिड सिक्रेशन करेगा, थोड़ा सा एसिडिटी मतलब एसिड सिक्रेशन करेगा, एसिड फॉर्मेशन करेगा. तो उसके लिए देखो बहुत सारे लोग बोलते हैं कि थोड़ा ड्रिंकिंग करना अच्छा है, मतलब वैसे ड्रिंकिंग करना ही नहीं चाहिए, ठीक है, लेकिन बोलते हैं. सो बिकॉज ऑफ इट कॉजेज प्रमोशन ऑफ एसिड. सो इससे अच्छा है कि एपेटाइट इट विल एक्ट एज एपेटाइट स्टिमुलेंट. ओके, सो इन अ लो डोज अल्कोहल विल एक्ट एज एपेटाइट स्टिमुलेंट, एपेटाइजर. सो भूख बढ़ाएगा आपका इनिशियल इन स्मॉल कॉन्सेंट्रेशन. इन अ हायर कॉन्सेंट्रेशन इट विल डिक्रीज द एसिड फॉर्मेशन. बाद में अगर ज़्यादा पीना चालू किया आपने, फिर आपका जीआईटी खराब होगा. Decrease in the acid secretion in the stomach, irritation, vomiting, gastritis, and mucosal congestion. So initially, it can stimulate the acid formation in a small doses. If you take alcohol in a large doses, then your GIT membrane will be damaged. There will be irritation, vomiting, gastritis. These are the complications. Alcohol, ethanol in a smaller dose, that is good. In a large dose, that is a very bad. So what is the action of this ethanol on liver? So chronic use of alcohol causes liver damage because of the production of acetaldehyde, which is a metabolic product of your alcohol. So alcohol after metabolism, you are getting aldehyde. So principally you are using ethanol, so that's why aldehyde. So if you are accidentally use methanol, then there will be formaldehyde. I will explain this in the metabolism of alcohol. Again, it will cause inflammation. It will cause inflammation to hepatocyte. Means it can damage your. It causes the inflammation of hepatocyte. Also, it is also known as alcoholic cirrhosis or alcoholic liver cirrhosis. And this is the most common cause of hepatitis. Whatever hepatitis patient they are coming to a hospitals, majority of them are because of the alcoholic liver cirrhosis. Because of overconsumption of alcohol, their liver is getting damaged. Again, this alcohol is a potent microsomal enzyme inducer. So whatever enzymes responsible for the metabolism of drugs and other other drugs or other metabol other so whatever metabolism is done by these enzymes, whatever microsomal metabolizing enzymes are there. So lipidic microsomal enzyme responsible for the metabolism of drugs. So those will be induced. Those will be induced by this alcohol. So obviously, if you take alcohol with your medication, so the metabolism of that drugs will be increased. So you are not going to get proper therapeutic effect of that drug. So if you don't use alcohol when you are when you are on a treatment, so that's why, because microsomal enzyme inducer is there. This alcohol is a potent microsomal enzyme inducer, so it can accelerate the metabolism of your concurrently used drug. So you don't have to use this phenol when you are using other medication. Then this alcohol also increases the fatty acid synthesis. So because of that, you are getting more obese. Obesity is the alcohol or drinking is the one of the major cause for obesity, because this alcohol will mobilize your fats. It will also increase the synthesis of your fatty acids. So that's why fatty liver is also one of the major effect on the liver. Okay, so alcoholic cirrhosis, fatty acid, fatty liver, then obesity. Okay, so this will be the effect of this ethanol on liver. Now next, what is the action of this ethanol on skeletal system, skeletal muscle, skeletal muscle? So muscular myopathy is the alcohol is used for long term. Myopathy is because of the chronic alcoholism. So if any patient is there which takes this liquor for chronically, so he may suffer from myopathy. Myopathy means degradation of your muscles. So whatever skeletal muscles are there, this is a bicep दिखा or tricep दिखा. If you are using ethanol chronically, then there is a myopathy due to chronic alcoholism. And remember, this alcohol follows zero order kinetics. Zero order kinetics of elimination. Zero order kinetics of elimination means what? A constant fraction of drug will be removed irrespective of its plasma drug concentration. I have already explained this point when we was discussing the kinetics. Okay, so what do you mean by zero order? Zero order means a constant fraction of drug will be removed per unit time without regardless plasma drug concentration. That's, remember, alcohol will follow zero order and gives highest energy. Now this alcohol will give you highest energy per mole. So 1 mole of alcohol will give you 7 calories. Okay, 7 calories. Then one one mole of your carbohydrate and protein will give you 4 calories, and 1 mole of your lipid will give you 6 calories. But 1 mole of your alcohol will give you 7 calories. So highest calorie is given by alcohol, but these calories are not useful for you. So you cannot call alcohol as a food. So alcohol is not a food. So though it can give you higher calories than other like carbohydrate, protein, and lipids, cannot be used food as a food, because it will leave the cells in. So it is giving higher amount of calorie per mole. 7 calorie per mole. Alcohol will give 7 calorie per mole. Then carbohydrate and protein will give 4 calorie per mole. Then lipid will give 6 calorie per mole. But this alcohol is not considered as a. These points are important for your GPAT. So remember, liver cirrhosis, it causes hepatic damage, then increase in the synthesis of fatty acid. It will mobilize your body's fat, and it will increase the absorption of fat. It will produce the de novo synthesis of fat. That's why obesity, alcohol-induced obesity. Intoxication of alcohol. Next one is intoxication of alcohol. So intoxication means if you consume a higher amount of alcohol or ethanol, so in that case you will develop a poisoning due to ethanol. Okay. So your body will not tolerate this. So intoxication of alcohol or ethanol. ज़्यादा पी लिया बेवड़ा होके गिर गया किधर. Naltrexone is the approved drug by US FDA for urgent comprehensive treatment program of alcohol dependence. को अगर अल्कोहल की लत लगी है, alcohol is nothing but the habit forming. Alcohol is nothing but the habit forming lipid, and it also tolerance is also there. So जैसे होता है ना, किसी ने अगर नया नया पीना चालू कर दिया, तो उसको एक पैक में ही वो टूल हो जाए. तो मान लीजिए उसने आज एक पैक पिया, टूल हो गया, मतलब एक पर्टिकुलर फार्माकोलॉजी एक्शन उसको मिल गया टूल होने में. अभी वही अगर 15 दिन के बाद में अगर वो एक पैक पिया तो वो टूल नहीं होगा, उसको 2 पैक लगेगी टूल होने के लिए। और वही 2 महीने के बाद उसको वो 2 पैक में टूल नहीं होगा, वो 3 पैक में टूल होगा. That means increase in the dose is required to produce a certain pharmacological action. Increase in the dose of drug is required to produce a certain pharmacological response. That is nothing but the tolerance. Okay. So alcohol has a tolerance and it has also a liability for dependence. Highest liability for dependence. So that's why naltrexone is approved drug by US FDA for comprehensive management for this alcohol dependence. Remember, most of the time क्या होता है कि आपको ये मालूम होता है कि naltrexone is a nothing but the it is a opioid antagonist. आपको वो मालूम होता है, लेकिन it is also used in the treatment of alcohol management. ये भी आता है. Then acamprosate is also there. Then topiramate is the drug. Topiramate is the anti-epileptic drug that is also used in the management of alcohol dependence. Okay, acamprosate and topiramate. Remember these two. Then chronic alcohol dependence. The next point is a chronic dependence. So in case of acute dependence, you can use these drugs like naltrexone, then acamprosate, then is naltrexone, acamprosate, and topiramate. Drugs you can use for acute intoxication. For chronic dependence, disulfiram is the specific antidote for chronic dependence. Disulfiram. It is a aldehyde dehydrogenase inhibitor. Remember, aldehyde dehydrogenase inhibitor. So what is the role of your aldehyde dehydrogenase? What is the role of your alcohol dehydrogenase? We'll see in the upcoming slide. We'll see the metabolism of alcohol. How there is a metabolism of alcohol in your body. We'll see what is the alcohol dehydrogenase inhibitor. Which drug is aldehyde dehydrogenase inhibitor. So just remember. So disulfiram is nothing but it is also known as anti-agonist. The trade name of this disulfiram is anti-agonist. Okay, याद रखो यहाँ पे लिखा नहीं है. Which is a aldehyde dehydrogenase inhibitor. Now use of this drug should be exercised, or use of this drug should be in a only hospital. So strict treatment should be carried out only in presence of medical supervision. So treatment is carried out only in a hospital because consumption of this drug or use of this drug for dependence management could prove dangerous. It can be dangerous. Treatment should be carried out in the hospital. Why it is dangerous, I will explain in the next slide. Another alcohol is there known as a methanol. Methanol. So methanol is nothing but it is known as a wood alcohol. It is known as a wood alcohol. याद रखो इसको बोलते हैं wood alcohol. Ethanol को क्या बोलते हैं? Ethanol is known as a sugar alcohol. Remember, ethanol is known as sugar alcohol. Methanol is known as a it is metabolized by alcohol dehydrogenase, and after that aldehyde dehydrogenase. So it is taken up in the body. It is metabolized by first alcohol dehydrogenase converted into formaldehyde. Okay, and then formaldehyde is taken up by enzyme known as aldehyde dehydrogenase and converted into formic acid. Ethanol is a poisonous in nature. It is a very poisonous in nature. Ethanol is a poisonous in nature. Ethanol can be used in the treatment of management of poisoning due to methanol because of the competition towards the alcohol dehydrogenase. तो इसमें देखो मिथेनॉल जो है पॉइजनस होता है. You might have seen news in the TV और इसकी गाउठी दारू पीने की वजह से 10 लोगों को बाधा हो गई या फिर 10 लोगों को पॉइजनिंग हुआ. क्यों? Because see, during the fermentation process along with the ethanol, some part of methanol will be generated. That methanol will poison the person who will drink that. That's why. So methanol is a poisonous in nature, and ethanol can be used in the treatment of methanol poisoning. Why? Because ethanol and methanol will have a similar structure. They will compete for enzyme known as alcohol dehydrogenase. Okay, so whatever the symptoms caused by methanol will be decreased to some extent by use of ethanol. Then next, omeprazole के ऊपर GPAT में क्वेश्चन आ चुका है, ऊपर भी क्वेश्चन आ चुका है, डाइसल्फाम के ऊपर भी क्वेश्चन आ चुका है. Omeprazole, so it is nothing but the 4-methyl pyrazole derivative omeprazole. It is a specific inhibitor of alcohol dehydrogenase. तो ये जो है ड्रग वो अल्कोहल डीहाइड्रोजनेस को आपका इनहिबिट करेगा, आपका डाइसल्फाम aldehyde dehydrogenase को इनहिबिट करेगा. So it will prevent the conversion of ethanol into acetaldehyde. It will prevent the conversion of ethanol to acetaldehyde. Disulfiram will prevent the conversion of acetaldehyde to acetic acid. Okay. Just remember specific inhibitor of alcohol dehydrogenase. This is nothing but the omeprazole. Okay. Then disulfiram is a aldehyde dehydrogenase inhibitor. Again, commonly used alcohol ethyl ethylene glycol poisoning. So it is ethylene glycol is also used. Okay, it is used oxidized in the body in presence of alcohol dehydrogenase to glucoaldehyde. तो ये जो ethylene glycol है, it is oxidized in the body alcohol dehydrogenase to form a glucoaldehyde, and then glycolic acid by aldehyde dehydrogenase, and then oxalic acid, and step by step. So fomepizole is a drug of choice. Management of ethylene glycol poisoning. याद रखो इसके ऊपर भी क्वेश्चन आ चुका है. Fomepizole is drug of choice. It is used in the treatment of ethylene poisoning, ethylene glycol poisoning. Now we'll see the metabolism of this. We'll see the metabolism of alcohols, ethanol plus methanol in the body. How alcohol is metabolized in the body? What are the metabolic products, and what is the effect of that metabolic product? Metabolism of alcohol. Metabolism of alcohol. First, we'll see ethanol. This is your ethanol. Ethanol in the body is metabolized by alcohol dehydrogenase first. First step क्या है? Alcohol dehydrogenase will metabolize ethanol into acetaldehyde. Then acetaldehyde will be then metabolized into acetic acid. So alcohol dehydrogenase will convert ethanol into acetaldehyde, and aldehyde dehydrogenase will convert acetaldehyde into acetic acid. So this alcohol dehydrogenase जो होता है, that is present in the cytoplasm. So that is present in the cytoplasm. This aldehyde dehydrogenase that is present in the mitochondria of the cell, hepatic cell, जो भी metabolism करने वाला cell होता है. So this is the metabolism of ethanol. This is how ethanol is metabolized. There is an increased level of ethanol in your body. You have consumed a huge amount of ethanol. So what will happen? Raised level of ethanol in the body result in the irritability, gait problem. Gait problem means क्या? आप अच्छे से खड़े नहीं हो सकते. देखो आप जो जो बेवड़ा आदमी होता है वो कैसे चलता है? वो ठीक से खड़ा भी नहीं हो पाता. Gait problem. That is gait problem that ataxia, motor incoordination, mental decrease in the mental functions, and memory decrease in the mental function and memory. So okay, जो नॉर्मल आदमी है उसके वो अगर रास्ते पे चल रहा है उसके उसके सामने जाके उसके ऊपर गेंद फेंको वो फटक से कैच कर लेगा. अगर वही आदमी अगर ड्रिंक करके चल रहा है उसको उसके 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 पास गेंद फेंको वो ठीक से पकड़ नहीं पाएगा. That is nothing but the motor incoordination. Okay? Then decrease in the mental function, thinking capacity, then memory and reaction time. Okay, so अगर आपने उसको एक स्लैप लगा दिया उसको, अगर ड्रिंक किया आदमी उसको स्लैप लगा दिया उसको 2 मिनट समझ में ही नहीं आएगा कि आपने उसको मार रहा है. कि 2 मिनट मतलब that is nothing but the reaction time. वो रिएक्ट करने के लिए टाइम जो लगता है वो डिक्रीज होता है. जैसे नॉर्मल आदमी को अगर आपने हाथ उठाने का एक्टिंग भी किया तो वो भी हाथ उठाएगा. लेकिन जो ड्रिंक किया है जो पूरा ड्रिंक है तो उसको हाथ उठाए तो उसको समझ में नहीं आएगा पहले 2 मिनट. सो दैट इज द डिक्रीज इन द रिएक्शन टाइम. इरिटेबिलिटी, सोशल प्रॉब्लम, गेट प्रॉब्लम, देन ataxia, motor incoordination, mental function, decrease in the mental function, decrease in the memory, decrease in the reaction time, coma and death. So these are the this will be the effect of ethanol. Know that ethanol is metabolized by alcohol dehydrogenase and it is converted to acetaldehyde. Now, increased level of acetaldehyde in your body. It will increase level of acetaldehyde in the body causes nausea, vomiting, headache, hypotension, inactivation of folate. This is the thiamine bioavailability. So this acetaldehyde is also not good for body. Please develop this acetaldehyde in the body. It will cause you this problem. Increased level causes nausea, vomiting, tension, headache, and decreased folate. Okay, inactivation of folate, and which is very important for 1-carbon atom reactions in your bodies. Folate is important, so inactivation of folate will be there, and decreased availability of vitamin B1. This you know that this acetaldehyde is taken up by this aldehyde dehydrogenase and converted into acetic acid. Again, this acetic acid is also bad for your body. It will cause systemic acidosis and all that. Okay, then systemic acidosis and all. Fomepizole is the drug used in the alcohol dependence treatment. Okay, it is a longer acting drug and it is an inhibitor of अल्कोहल डीहाइड्रोजनेज, अल्कोहल डीहाइड्रोजनेज को इनहिबिट करेगा तो आपको एसिटाइलडेट नहीं बनने देगा, ये याद रखो. Then again this aldehyde dehydrogenase is inhibited by this disulfuro. Aldehyde dehydrogenase is inhibited by this disulfuro. Remember, समझ में आ रहा है आपको ये सब. See the metabolism of your methanol. Metabolism of methanol. So methanol is metabolized by first alcohol dehydrogenase and converted into formaldehyde. This level of formaldehyde in the body will cause metabolic acidosis, ocular toxicity, respiratory failure. That's why methanol is more poisonous than ethanol. Then again, this formaldehyde is taken up by this enzyme known as a aldehyde dehydrogenase and converted into formic acid. And again, formic acid is a toxic to your body. That's why methanol is a more toxic than ethanol. Metabolism of ethylene glycol. Ethylene glycol first will be taken up by alcohol dehydrogenase, okay, and converted into glycoaldehyde. This glycoaldehyde causes depression of CNS, metabolic acidosis, and nephrotoxicity. Glycoaldehyde is again taken up by this aldehyde dehydrogenase and converted into glycolic acid, which is then converted equilibriumly with the oxalic acid. This is the metabolism. इसके ऊपर भी आपको एक या दो क्वेश्चन आ सकते हैं. They can ask anything. So which one is a specific alcohol dehydrogenase inhibitor? That is a Fombazole. Okay, and longer acting. Which one is a aldehyde dehydrogenase inhibitor? That is disulfuro. Also known as anti-agos. This Fombazole is also used in the treatment of poisoning. Maybe use करते हैं आप लोग. Fombazole is also used in the poisoning of this. You have two kind of alcohol. Mostly ethyl alcohol is used. Okay, so alcohol dehydrogenase is the enzyme. First will metabolize your alcohol in the body. Okay, alcohol dehydrogenase. So substrate for this enzyme is nothing but the ethyl alcohol and methyl alcohol. Okay. Ethyl alcohol means ethanol. Ethyl alcohol means these are the substrate. So preferred substrate for this alcohol dehydrogenase is the ethyl alcohol. Okay. Ethyl alcohol is a preferred substrate, and this alcohol dehydrogenase is inhibited by Fombazole. Now ethyl alcohol will be converted into acetaldehyde by this enzyme, and methyl alcohol will be converted into formaldehyde. Conversion of ethyl alcohol into acetaldehyde is 7 times more faster than conversion of methyl alcohol into formaldehyde. This formaldehyde, acetaldehyde, whatever will be is the metabolic product of your ethyl alcohol and methyl alcohol respectively. So they are again converted into their respective acids by aldehyde dehydrogenase. Okay, which is inhibited by this disulfuro. Getting over here, acetic acid from ethanol. Now this formic acid is a dangerous. This formic acid has a negative impact on this folate dependent coenzymes. Okay, then polinic acid will have positive. So you can, if there is a methanol poisoning, you have to use this supplement, polinic acid. There will be no blockage of this folate dependent enzymes. This is the metabolism again. This was regarding the alcohol chapter, and another chapter is there known as epilepsy or anti-convulsion drugs. Anti-convulsion drugs. So what do you mean by epilepsy? So again, epilepsy is the disorder of CNS. It is not a single disorder. It is a collective. It is a collective term for chronic seizures disorder having a common sudden transit episodes of seizures, loss of disturbance and consciousness, usually with correct body movement, which is known as a conversion.